what does manipulation do to the spine? Or what does it do for back pain? In short, if you've got a stiff joint, the manipulation that a chiropractor or an osteopath might do just frees up a stiff joint. It's not putting anything back, it's doing nothing like that, it's just freeing up a stiff joint. And this actually can be really, really helpful. If you've got an injury down here where this bottom part of the joint, of the lower back, is injured and damaged, and we've got some stiffness up here, actually releasing this stiffness and getting these joints moving again with a little bit of a oomph can just help the whole section work a little bit better and take some of that stress off here while it's healing. And for less severe injuries, it can actually be really, really helpful. But when you start looking into a lot of the research, it says, well, yeah, you can do joint manipulation, but it actually works better in combination with other things. And this is one of the things that we do here at the clinic. Now, we do some element of joint manipulation, albeit we use an impulse adjusting instrument where we're a little bit more specific and a little bit more direct with our applicator, and you can read that about that on the relevant section of our website. So we do an element of manipulation, but just not the traditional way. But we also use the other therapies to actually enhance that process. So we do some manipulation to the joints in the spine in a safe and actually a much more patient-friendly way, much more gentle. And then we also do some vibration work. So we'll work on these muscles either side of the spine. We'll work on these muscles around the hips and round down into the legs, because we know that actually, getting this joint working a little bit better is fantastic, but also loosening off the muscles that may be contributing to stiffness is even better. And also loosening off some of the muscles down in the glute region can allow the hips to move a little bit better, and those hips being less stiff takes more pressure off the lower back that's injured. And then the real game changers are using the decompression therapy, which actually takes pressure directly off the injured section. Because actually doing a violent twisting to manipulate a joint that's injured may not always be the most sensible approach. And when I personally used to do those manipulations, manually, by hand, you wouldn't, a responsible person wouldn't manipulate an injured disc, for example. You try and go elsewhere and try and get other joints moving better. And then we also use laser therapy, and laser allows us to speed up the healing in this region. It's incredibly safe and incredibly gentle, but it really completes that treatment process. And you'll see on our website, we call this the Mayfair method. It's the way in which we approach treatment, by hitting all of these different parts of the problem simultaneously to get a more effective healing effect on the patient. And that is, of course, combined with rehabilitation and exercises and a fantastic examination and consultation process as well. But yes, manipulation in short can be helpful for back pain, but it's such a small part of so much more you can actually do to help the patient and see much better results with that more comprehensive approach.
Thanks for taking the time to watch this video. For more videos like this and recent uploads, click the link up here. If you want to learn more about our Back in Shape program and how it can help you from home, then click the link here. And remember, to stay up to date with all the latest videos we post, subscribe by clicking the button above my head. Thanks for watching.